and we are going to start off with a fabulous guest. His name is Scott Bruun. He's Executive Director of the Chronic Disease Coalition. He's a former state representative from Oregon, the 37th District, and regularly provides expert analysis on both politics and advocacy issues on local newscasts. He is a type 1 diabetic patient, which factors in greatly into what we're going to discuss here, and he's also a father of a type 1 diabetic daughter. Welcome, Scott.
Hi, Kathleen. How are you doing?
I'm fantastic. It's so great to have you. We're going to talk about a California bill. It's California SB1156, and I live out here in California. And although this bill and this concept is starting out here in California, we know that this kind of legislation is propping up all over the country. So I want to start with you talking a little bit about the bill and kind of fill us in on what's going on and why this is so important.
Yeah, no, absolutely. So Senate Bill 1156 was introduced this year, and basically what it is, it's another example of insurance company, in my mind, perniciousness, trying to really reduce costs by putting the burden of everything on the chronic disease patients. So specifically what 1156 would do, and if you read the language, you don't quite see, the effect. But the effect of 1156 would be this: it would effectively eliminate the ability for chronic disease patients to use charitable assistance to help them with their premium and copays. So what does that mean? It means if for some reason you're on commercial insurance, whether through a company or through the exchange or something like that, and you lose your job or your ability to kind of pay for that insurance. There are groups out there, charitable nonprofit groups, that will help you with your premium assistance to keep you on insurance. What this bill would do is effectively eliminate that, and of course, insurance companies love that because it's a way to get expensive chronic disease patients off the rolls. While this bill doesn't specifically talk about dialysis or kidney failure, that's probably where it will have the most effect. Right now, already about 90% of folks that have kidney disease or ESRD, end-stage renal disease, are on Medicare. And that's because years ago Congress made the right choice, in my mind, to say that kidney disease is such a bad thing that no one should ever go without coverage. And so they allowed Medicare to be used for any kidney patient, regardless of their age. So already right now, about 90% of folks that have kidney failure are on Medicare. So the other 10% that are commercially insured. And as you know, Kathleen, I'm sure you've talked about before, Medicare, Medicaid, Medi-Cal just don't pay the bills. And so if the insurance companies are successful, frankly, in reducing the amount of people that can remain on their commercial insurance, it will drastically upend the dialysis, world. It will be very damaging for patients.
So I want to be clear about this because, on one hand, it just doesn't make sense. So what you're saying is the insurers do not want to insure these patients any longer because they're expensive.
Right.
And the part that doesn't make sense to me is why would they not want these patients to get assistance, charitable assistance?
Yeah, it is. It's a great question. The reason why is because if these patients cannot get the charitable assistance, they're probably going to be forced off of commercial insurance simply because they can't pay the bill. A lot of low-income folks, and in that situation, they will go on to Medicare, and the insurance company can kind of wash their hands and walk away, and no longer need to insure that, and truly, very expensive dialysis patient.
Wow. So basically, to break it down, if you've got someone paying an insurance premium, obviously that premium is not covering the cost of their dialysis, for example, because they're a very expensive patient.
Right.
So if they can't pay the premium, then they're gone off the rolls. I mean, doesn't that fly in the face of what Obamacare was meant to do and take care of?
Exactly. But the problem with the Affordable Care Act and Obamacare is that written into the rules, I think 2009 or 2010, I think 2010, I believe, they actually gave permission, or at least didn't effectively stop that from happening in the states. And so in the Affordable Care Act, it says that an insurer has to accept charitable assistance, third-party charitable assistance from certain organizations like the Ryan White HIV/AIDS Foundation and tribes. So that's always been in the law. But it leaves gray, it's a loophole, if you will, whether other sort of nonprofit charitable groups can play into that. So insurers across the country, now California just is the biggest example right now, but it's happening in many other states where the local insurance companies, the bigger ones, and of course AHIP, which is the lobbying arm of the insurance companies, they're using that loophole, if you will, to try to establish a toehold to dump these patients, and it's that bad. But
Wow.
you know, you're exactly right, Kathleen. I mean, the whole idea of Obamacare, in my mind, and as somebody who thinks about it as somebody with chronic diseases and a dad of one as well, it was about making sure that people with pre-existing conditions could stay where they were supposed to, with the doctor they wanted to be with. We're not left uncovered, if you will. And this particular case, 1156 in California, does exactly the opposite of that. It would leave the most vulnerable population, and if you've known people that have, had to use kidney dialysis before, it's a bad situation. I mean, frankly, you have to go into a clinic, 2 to 3 times a week to remove the toxins from your blood. Without it, you die. It's just, there's no question about it. And it is expensive. There's no question about it. But it's what's keeping these people alive. The thing that irks me a little bit about 1156 in California is, nationwide, there's about 800,000 people that have this end-stage renal disease or kidney failure. In California, it's about 66,000 people that have ESRD. But again, 90% of those people are already on Medicare. We're only talking about 6,000 or so people that are commercially insured in California that have kidney failure. And among those, we're really only talking about 1,000 people that rely or potentially rely on the premium assistance. So here we are in a huge state like California. Could be a model for the nation, and insurance companies are targeting 1,000 people, the most vulnerable people in the state of California.
That's just insanity. Please continue.
No. I mean, I just want to know the fact. One of the point is, this disease, like a lot of chronic diseases, really has a disproportionate impact on African Americans. So, African Americans make up about 13% of the U.S. population, but they are over 30% of the ESRD population. So it absolutely has a disproportionate impact on minority groups. Bad news in my mind.
It's really bad news. And, it just strikes me as so ironic for a state that is now a sanctuary state for, illegal immigrants to come into and stay here. And I mean, they're truly turning the state into a third world country. I don't know if you've been to San Francisco recently, but it's gotten just deplorable.
Well, I live in Portland. There's many similarities.
Oh my gosh. I mean, yes, I could go on and on, but I find it so ironic that the state that's, a feel-good state and wants to make sure, everybody's welcome, etc., is passing a bill to, harm some of the most vulnerable citizens in our system. It's just, at least it's going through the legislature, not necessarily passing. So who's behind this bill?
Yeah, that's exactly what I think your last comment leads into. So, California, like my home state of Oregon, is a little bit of a feel-good state. There's no question. And, at least from a public policy, public voice standpoint, it's always, looking out for folks that could be potentially harmed, social justice, and all that. But the fact of the matter is, when you're in state capitals, whether it's Sacramento, whether it's my state capital, Salem, whatever state capital it might be, you have an extraordinarily powerful lobby group in the insurance companies. So, a lot of these big insurers, the Blue Cross Blue Shields, the UHSs of the world, all have their individual lobbyists. And then one of the largest lobby organizations in the country is an organization called AHIP, which is America's Health Insurance Plan. And I give them credit. I mean, truth be told, as a former legislator, they are powerful, and they know how to find votes. They know how to, manipulate the levers, if you will, and they're effective. I mean, they're good at what they do. The problem is that chronic disease patients, folks that are sitting in a dialysis center 3 times a week, people with other chronic diseases, whether it's diabetes, rheumatoid arthritis, you name it, don't have expensive lobbyists at their beck and call to be, roaming the halls of Sacramento every day. And that's really the issue here. Yeah.
So, I mean, these people are really just really at the whim of these big lobbyist groups. And go ahead.
Well, no, yes, is the answer to that. And part of it is, I spent 6 years in the Oregon legislature. You are faced with thousands of bills every session, and you cannot become an expert on everything. And part of the problem is I'm not trying to diminish the California Assembly or the California Senate, but what I'm saying is you've got, extraordinarily sophisticated.
Scott, we're up against a hard break, and I was wondering if we could hold you over till the next segment.
Absolutely, yeah, thank you.
Oh, that'd be great, because there's so much to talk about with this. This is Kathleen Antrim. We are Silk and Antrim. Don't touch those dials. A lot more to come. This is the Main Street Radio Network.
Getting your kids ready for back to school is exciting, but can also be stressful when it comes to shopping and managing rising school costs. According to a new survey by Coinstar, 2/3 of parents believe that school expenses are increasing year over year, and the majority revealed that back to school shopping creates anxiety. Most parents anticipate clothing to be their largest back to school expense, hitting their household budget the hardest. Adding to the load, 3 in 5 parents say they or their children feel the pressure to keep up with the latest fashion trends, which often carry a hefty price tag. But parents are getting creative in managing costs and stress levels. The majority will create a back-to-school budget and use other strategies to help stay on track. These include shopping for clothing and supplies at discount or secondhand stores and cashing in spare change to offset school expenses. With some advanced planning and employing simple budget strategies, getting ready for the new school year can be fun for both parents and kids. To find a Coinstar kiosk near you to turn your coins into cash or a no-fee e-gift card, visit Coinstar.com.
The first ever large-scale study of reproductive history and dementia risk was reported at the 2018 Alzheimer's Association International Conference in Chicago. The study of more than 14,000 women finds that those with 3 or more children had a 12% lower risk of dementia compared to women with only 1 child. In addition, women who had their first menstrual period at 16 or older were at a 31% higher risk than those whose first period was at 13 or younger. Dr. Maria Carrillo is the Chief Science Officer at the Alzheimer's Association.
Almost 2/3 of Americans with Alzheimer's disease are women. We need more research to gain a better understanding of sex-specific risk factors across the lifespan. This may help us discover specific dementia prevention strategies for different groups of people.
For more information, visit alz.org. That's alz.org.
Hey, what's up, everybody? I'm Jason Derulo. I love that music connects to people all over the country. But unfortunately, so does something else. Childhood hunger. 15 million kids struggle with hunger right here in America. And yet, every year, billions of pounds of surplus food in the U.S. go to waste instead of going to the children in need. Feeding America is working to change this. The Feeding America nationwide network of food banks rescues this surplus of food to help provide meals to families in virtually every community in the United States, including yours. But they just can't do this alone. Join me in the fight against hunger in America. For more information on what you can do to get involved, visit feedingamerica.org. That's feedingamerica.org. Together we can solve hunger. Together, we're Feeding America. A message from Feeding America and the Ad Council.
Hi, it's Practical Polly's radio show. If you're just figuring out that healthier cooking oils are better than solid fats, you may be asking, now what am I going to do with all these tubs of lard? Ever had one of those moments when your favorite skinny jeans feel too tightly tailored? Generously apply lard to your hips and thighs and those fancy pants will slide on like a dream. Or here's a family-friendly idea. How about making your yard into a lard fun park? Frost your driveway with a nice thick coating and give those kiddos a downhill thrill no matter what time of year. Having a bad hair day? Yep. A little lump of lard can tame your flyaways in a jiffy. So there's no need for that lard to go to waste or to your waste. But get your best heart-healthy trade-up with healthier oils like canola, olive, or other vegetable oils, which can actually lower your chances for heart disease. Now that's a tip worth keeping for life. Learn more at heart.org/facethefats. Canola Info is the national supporter of the American Heart Association's Face the Fats campaign.
Welcome back, everybody. Welcome back to Silk and Antrim. I'm Kathleen Antrim. Jane Silk is off on assignment, so we're rolling solo today. We have got an amazing show packed with information. You're not going to want to miss a single minute, so don't touch that dial. And right now we're talking to Scott Bruun. He's the Executive Director of the Chronic Disease Coalition. He's also a former state representative in Oregon, and so he understands how everything works behind the scenes in the legislatures. And he regularly provides expert analysis on both politics and advocacy issues on local newscasts. Welcome back, Scott. So great to have you.
Yeah, thank you.
So when we left the last segment, we were talking a little bit about California state legislature and lobbyists. And I want you to talk a little bit about the process and the strength of lobbyists.
Yeah, no, I mean, again, there's two lobbying entities that have more strength than all the others combined, and that's really kind of the healthcare and the financial services sector. And within the healthcare side of things, it's no secret that the insurance companies, they punch big. I mean, they're the 800-pound gorillas in the room, in the Capitol, whatever Capitol you may be talking about. And as I mentioned before the break, the lobby organization that is, and again, I tip my hat to them because they're extremely effective. But that's AHIP. That's the acronym they go by, and it stands for America's Health Insurance Plan. It's simply just the lobby group of all the insurance companies, or most of the insurance companies across the country. Their job is to go in and talk to legislators, influence legislators, and get them to go with whatever plan or whatever piece of legislation they're putting. Insurance companies have been very good when it comes to some of the chronic disease and discrimination issues that we were talking about. They've been very good about working the system, finding the bureaucratic loopholes, or in the case of California, just strong-arming the system to change the law, and that's what Senate Bill 1156 is. Now, I mentioned earlier.
Can I ask a question about that?
Sure,
I mean,
yeah.
Just to summarize quickly, especially if we have listeners tuning in now.
Yeah.
So essentially, if I understand this correctly, this is a bill that has been proposed, and the lobbyists are pushing hard, basically so that they can, no pun intended, cripple some of the weakest and most vulnerable citizens we have by being able to knock them off of their insurance, so that the insurance company doesn't have to cover their dialysis or what have you.
That's exactly right. I mean, and of course, they wouldn't use that phrase. They would talk about, they'd have much, detail of why it's necessary and all those sorts of things. But the net effect of this is that dialysis patients in California, and again, I mentioned there's about 66,000 of them. Really, initially, we're only talking about 1,000 that would be affected by this. It is to force them off of commercial insurance and onto taxpayer-funded government insurance. And so that's another way to, view this as well, as the insurance companies are doing everything possible to put the burden that they should have onto the back of taxpayers. And that's what will happen in California if this passes. One of the bigger problems with 1156 in California is not just those 1,000 patients, although that's the first issue. If that were to happen, if this bill were to pass, what's going to happen is you're going to see much less insurance coverage for these dialysis centers, and much more reliance on Medicare. But as I mentioned earlier, Medicare doesn't pay the bills fully. And any provider knows that Medicare, Medicaid, Medi-Cal, all those things only pay 60, 70, maybe 80 cents on the dollar. And so the model of kidney care, the patient, forget about the ones commercially insured. Talk about the ones on Medicare. The model of Medicare the model of kidney insurance those Medicare patients rely on is hugely at risk because of 1156. And again, if insurance companies are doing this across the country, California happens to be the biggest issue. But if this is successful in California, you will see this roll out in various states across the country, something similar.
So what other, we're talking about dialysis, and kidney failure, but what other chronic diseases will this impact?
Yeah, it really affects. It's not a dialysis-specific bill at all. It's a charitable premium assistance bill. So any disease that relies, or excuse me, any patient, any chronic disease patient that might find themselves in a situation where they temporarily, or whatever the case may be, need to rely on charitable copay or charitable premium systems, it puts them at risk. So one example, my wife says I'm the healthiest unhealthy person she knows. I've type 1 diabetes for 35 years. I'm a cancer survivor. I also have rheumatoid arthritis. Well, speaking of the arthritis, I take a biologic that without it I'd be in a wheelchair, but with it I can run and climb mountains. But it's expensive, and there's times when you may need charitable assistance to help you bridge a gap in insurance if you change jobs, something like this. This bill would also put in jeopardy those sorts of things. So it's a much bigger chronic disease patient population than dialysis and kidney disease, but that's where the most immediate effect will be seen.
So, I mean, do we have any numbers on that? I mean, it's, obviously, dialysis is one aspect, but the impact of this is going to be seen in a much greater way. So do we have numbers on that?
Well, I mean, as far as, who it'll affect, I don't have the numbers of other California patients that it will affect beyond the dialysis. Again, the most immediate, that's what's so agonizing about this is really the insurance companies are using 1,000 people to play this game with. I mean, come on, find a way to keep 1,000 people insured. That in a state like California, that shouldn't be a problem. And of course, you're talking about many insurance companies, not just one bearing the burden of these 1,000 people.
Well, and it flies in the face.
I mean, we know. Yeah, I mean, we know that there's 200+ million patients across the country who suffer from chronic disease or comorbidities, multiple chronic diseases. So,
right.
California, 10% of the population, is probably 20 million people.
Wow. And I mean, would this also impact, for example, cancer patients who might have a chronic situation where they're fighting it and perhaps they go into remission, but then, come out of remission, that kind of thing? Will it impact people with those diseases as well?
Kathleen, that's a great question. That is exactly right. So if you're in a situation where you are, it may be an aggressive cancer treatment, maybe something that's new and cutting edge. If you're in an insurance situation and you lose that insurance or lose the job, that's probably the best example that is with the situation. And you rely on charitable third-party assistance to help you with that. This bill, if it passed, would give insurance companies the ability to no longer accept that and force you onto the back of taxpayers, force you onto government insurance. It
just seems insane to me. So they're going to try to pass a bill to put the charities out of business who are helping these people.
Isn't that ridiculous? Yeah, isn't that ridiculous?
I mean, I want to clarify to make sure I'm saying that correctly, right? They want to put the charity out of business that are helping these,
and again, the charities are what the charities are. I mean, I think yes, that's true, but I think the most pernicious effect is to put the chronic disease patient out of business, if you will,
right,
and out of their insurance coverage. But yes, it's again, these insurance companies do not like to cover expensive chronic disease patients. I mean, chronic disease patients are more expensive, and that's kind of the point.
And it's a matter of life and death. So what can people do to fight back against this bill and stop it?
Great question. So a couple things. First of all, I would highly encourage your listeners in California to reach out to their assemblyperson or their senator and to oppose Senate Bill 1156. Now, this bill has already got through the Senate side. It's now on the Assembly side, and it's in the appropriations. And I know the California Assembly is adjourned right now, and I think they get back in early August. So right now is the perfect window during the summer to reach into your legislator who are probably home in their home districts and tell them no, no, no on Senate Bill 1156. There's also something happening nationally, which I'm looking forward to.
And you know what, Scott? We're up against another hard break, but I really appreciate you coming on. Thank you so much, Scott Bruun, the Executive Director of the Chronic Disease Coalition. Call your legislatures, people in California. Stop 1156. This is Kathleen Antrim with Silk and Antrim, and this is the Main Street Radio Network. Stay tuned.